Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academic channel. Now we have started the serial Ayurveda in Medical General Practice, and today's topic is backache. For paid online consultation, please note down my mobile number 922681063092268106309. As you know, I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, I have given you my number. Now, today we will discuss about the very common problem in general medical practice, that is backache, that is the back pain. We are going to discuss nearly 55 conditions in our medical general practice. We will discuss etiology or the causes. We will discuss the investigations, and I am giving you the lot of prescriptions, ready-made prescriptions that you can try in your general medical practice with my experience and intelligence. So, etiology of the backache, diseases of the vertebral column. For example, Pott's disease. As I have mentioned in the first video, that tuberculosis can affect any part of your body. We think tuberculosis, lungs. Tuberculosis, lungs. That is not correct. Tuberculosis can affect your vertebral column, that is the bones. Tuberculosis can affect your abdomen, ileocecal joint. Tuberculosis can affect your skin also. So, my dear friends, Pott's disease is also called as a cold abscess, that is the bone infection of because of the tuberculosis. Then there may be some tumors, may be malignant or cancer, or maybe without cancer, that is the simple tumor, like the we called as a benign tumors. Okay, diseased intervertebral disc, slipped disc, that is prolapsed intervertebral disc. When it is prolapsed over here, then I will get the tingling numbness in my hands. When my lumbar vertebrae is having the slip disc, then I will get the tingling numbness or the pain in my either of legs or both the legs. Okay, prolapsed intervertebral disc, PID. Nowadays, X-ray and MRI can give you the 100% diagnosis. Sacroiliac arthritis, that is pelvic girdle, osteitis fibrocystica, fibrous changes in the muscles, then osteitis deformans, osteomalacia, infections, osteoporosis, your bone density becomes less. This is a degeneration of various types. Then congenital malformation, for example, sacralization of fifth lumbar vertebrae, rare. Multiple myeloma and malignant deposits. That means your cancer may be in the intestine, your cancer may be in the liver, your cancer may be in the uterus, but metastasis, spread of the cancer cells, can occur in any bones. Remember those things. Then diseases of the spinal cord and meninges, trauma, accidental injury, road accidents, or when you are taking something from the high, you can fall down from the stools and the chairs, and that can damage your back vertebral column. Infections and the neoplasm is a cancerous growth. Soft tissue involvement, that not directly bones, because we consider musculoskeletal system. Muscles, bones, joints, ligaments, tendons together. Okay, fibrositis, that is lumbago, acute traumatic injury, accidental injury causing the contusions, then hemorrhage, rupture of the muscle fibers or the ligament, especially very common in the knee joint or the ankle joint ligament. During the sports, ligamental injury is very common. Acute infections like the influenza or exanthemas, that can also create your backache, the pain in the back. Diseases of the abdominal or pelvic organ. So remember that when you get the backache, it is not only you have to look for the vertebral column, but you have to look for the whole body problems. Like for example, if you have the problem in the abdomen or pelvic region, that can give you the backache problem. For example, if your pancreas, you know, this is the organ on the left side of your body, that is the abdomen, middle abdomen part, and it is very essential for the insulin formation, because beta cells of Langerhans, that pancreas is giving you the insulin, which is essential for the metabolism of the glucose. And when those insulin is less, you get the diabetes mellitus. But that pancreas can have the tumor, can have the cyst, or can have the chronic pancreatitis. Even you know, acute pancreatitis, severe pain in the abdomen. But I am not talking about pancreatitis. I am saying pancreas problem can give you the backache. Don't forget. Then lymph node problem. That, for example, lymphosarcoma, cancerous growth, Hodgkin disease, and lymphatic leukemia, again blood cancer. That can give you the backache. Retroperitoneal hematoma. Peritoneum is a covering in the abdomen, and there is a hematoma like a blood clot. Okay, aneurysm of the abdominal aorta. Then kidney diseases, for example, renal calculus, stones in the kidney, tumors, tuberculosis, polycystic kidney, hydro or polynephrosis, and pylo means pus, pyelonephritis. So kidney problem can give you the backache. Don't forget. Diseases of the female genital organs, like the problem in the uterus, problem in the fallopian tubes, problem in the ovary, that can give you the backache. Of course, the lower backache. Then the diseases of the prostate gland in the males can also give the, especially the prostate cancer, gives the metastasis to the vertebral column or the bones. Cancer of the rectum, that is also again the metastasis, spread of the cancer. What is metastasis? Spread of the cancer cells in anywhere of the body. Then faulty body mechanism. This is very common in the IT people, because which are working with the computers, information technology, what you say, the world MNCs, multinational companies, they are sitting for 10 hours together, and then they start the backache because of the faulty posture of sitting, faulty posture of standing, no exercises, sedentary lifestyle, no joint exercises. Here. Look. I am telling you one very interesting thing. Dr. Deshpande's Ayurveda Academy channel is superb for the students, for the doctors, for the patients, and for everybody. And it contains the Ayurveda subject, health subject, astrology, palmistry, yoga, everything. In the yoga, please, my dear friends, please click the yoga playlist and you will get the training of excellent joint exercises. Dr. Deshpande had taught these exercises to the foreigners. I have visited 1993 to 2014, 20 years to America, Switzerland, Germany, to Spain. So a lot of experience. So please don't miss that experience. You can check how to do the exercises of the different joints on my channel, on the YouTube, and there you will get the playlist yoga, YOGA. Okay. So defective posture, constant use of the two-wheelers on the rough roads, and the last but not least, tension can give you the backache. That is psychoneurosis. Now, what investigations you can do? X-ray, the simplest and cheap investigation, affected part like X-ray cervical spine or X-ray lumbar spine, AP and lateral view, and then to rule out the vertebral cause, you can do the MRI. Nowadays, MRI is also done by the consultant, and that's very useful to give you the more clear idea. Even Potts disease, you can do the CT scan. That is also helpful. USG abdomen to rule out the abdominal pathology. Now, my dear friends, start the treatment, Ayurveda treatment. Rule out the cause. Rogaha, what Ayurveda says? The Sankshepattaha, Kriya Yogo, Nidana Parivarjanam. Try to avoid the causes and treat accordingly. Backache due to the Potts disease. Naturally, you have to give the AKT, anti-Cox treatment, if the tumor is causing the backache. If indicated, you can do it by removing by that tubectomy. That tumor can be removed by the surgery. For females, if there is any gynecological pathology like pelvic inflammatory disease or uterine or ovarian cause, treat that particular cause. Faulty body mechanism or the body posture can be corrected by proper training of the patient, and exercises of yoga can be done. Even physiotherapy is the best for the backache. More common problems found in the GP are mentioned here. Now we will start the treatment prescriptions, but because that any pain anywhere in the body, especially musculoskeletal and neurological pains, according to Ayurveda, that is the imbalance in Vata dosha. Don't forget that. So Vata prakopak ahar vihar should be avoided, which will disturb your Vata. Vata is responsible for all types of movements: heart sounds, lung sounds, peristaltic sounds, and your body movements. My dear friends, Vata prakopak, you try to avoid the ruksha gunatmaka, dry food stuff, only sandwiches, only popcorns. Not good. You have to drink the milk. You have to drink the enough water. That will control the Vata imbalance. Dryness will be less. And snehana and svedana, best treatment for vata dosha. Application of oil and fermentation, these should be the must. Then for the vata dosha, panchakarma, basti is the best, especially when there is a degenerative changes. I will recommend yapana basti. Don't forget that. Otherwise, when there is a constipation, you can take simple anuvasana basti, oil enemata. And if there is a little complicated and like obesity, then you can take the Dashamula Niruha Basti also. So, my dear friends, so there are 2 or 3 factors that we have to consider in addition to the tablets. But here you can concentrate on the tablets. Triphala Guggulu, traumatic injury, anti-inflammatory analgesic, NSAIDs of Ayurveda, non-steroidal anti-inflammatory drug from Ayurveda, Triphala Guggulu, 2 tablets 3 times in a day. Vata Vidvams, 1 to 2 tablets 3 times in a day. Dashamula Rishta, 4 teaspoons with equal amount of water after a meal. For local application, Lepa Gori, you have to rub it in the hot water and make a paste. Then there is also Bajranga Lepa is also available in the market. And the most important is a proper rest. Inadequate 1 or 2 days is essential. Now, due to the osteoporosis, when your bone mass density, you can have the different machines available in the market with your general practitioner. You can test your bone density. And if you find it is less, then you can take Mahayogaraj Guggulu, 2 tablets 3 times in a day, Lakshadi Guggulu, 2 tablets 3 times in a day, Brihatta Vata Chintamani, costly medicine, 30 milligram 2 times in a day, Ashwagandharishta, best tonic for the regenerative purpose and giving you the energy, 4 teaspoons with equal amount of water, Dashamularishta, 4 teaspoons with equal amount of water. Local application, Mahanarayanati, that is Shatavari oil, followed by hot fermentation or hot shower. Regimen, proper rest and suitable exercises after the acute attack. Don't forget that. Tila Taila Enema, simple Anuvasana Basti at least 3 times in a week. Ayurveda recommends that for all the musculoskeletal problem, all the arthritic problem, all the vertebral column problem, your stools should be perfectly normal. Remember my words. If you are constipated, if you are suffering from amoebic dysentery, if you have to strain, if you have the sticky stools, your backache will never go. Never go. Please, please, please remember, your stools should be excellent. So must take some laxative. Anuvasan Basti is the best. Due to the slip disc, then Snehana, Svedana, oil application, fermentation, even the what we do, Kaya Seka. Avagaha Sved is also important. Katibasti. Then this combination is a must for these patients, supported by following treatment: Lakshadi Gugulu, 2 tablets 3 times in a day; Vata Vidvamsaras, 1 to 2 tablets 3 times in a day; Vata Vidvams, controlling Vata dosha energy, controlling imbalance of the Vata dosha. This is the tablet. Now, name is very important. Vata Vidvams. It is destroying the imbalance of Vata dosha. Siladin, tranquilizer of Ayurveda. Allersin company has made this tablet. It will tranquil your stress, anti-stress, stress relieving medicine, Siladin of Allersin company, 2 tablets only at the sleeping time. It is not a sleeping pill. It will not make you addict. Don't worry. Then or Yogaraj Gugulu, 2 tablets 3 times in a day. Gokshuradi Gugulu, antidiuretic, 2 tablets 3 times in a day. Gokshur is also best to give you the energy. Then Maharasnadi Kadha, Kwath is a decoction, Kadha, 4 teaspoons with equal amount of water, and Katipasti, Avagaha Sved, Sahachar oil or Mahavishagarbha tail can be used for this particular Avagaha Sved. Okay. Now, my dear friends, in Ayurveda for general practice, today we have discussed about the backache or back pain. I request all of you, don't forget to subscribe my channel and share this particular video. Thank you very much for your kind support. Take care and see you in the next video. Thank you.